Hello, everyone. Thanks for joining us today for a webinar on the FreeStyle Libre for hospitalized people with diabetes during the COVID-19 pandemic. We will have a brief presentation, with questions, and if you'd like to ask a question, you can type that into the questions box that you see on your screen. We are recording this webinar, and we will post it on our COVID-19 resource page, which is accessible by going to our website, diabeteseducator.org. So with us today from Abbott Diabetes Care are Megan O'Neill, Medical Scientific Liaison, Jeff Draper, Marketing Director of Government and Point of Care, and Bill Peters, Informatics and Service Manager. And from ADCES, as our moderator today, we have Joanne Rinker, Director of Practice and Content Development. So without further ado, I will throw it over to Joanne to get us started.
Thanks, Megan. So our first handful of questions are for Megan O'Neill at Abbott. And the first one is, can you clarify what the announcement on use of FreeStyle Libre 14-day system in the hospital setting is? And is this official FDA approval or guidance?
Thank you, Joanne, for the question. And yes, I would like to first share this website that Abbott Diabetes Care has to provide answers to many of these questions today. So just to provide some clarification, given the ongoing COVID-19 pandemic, the FDA has recently allowed use of the FreeStyle Libre 14-day system in hospitalized patients who are able to scan the sensor themselves. Extension of the use of the FreeStyle Libre system to the inpatient setting is expected to allow hospital staff to remotely monitor glucose levels and therefore reduce patient interaction, limiting viral exposure, and preserving personal protective equipment. And this webpage provides a lot of information and a lot of resources to help address many of the questions today. So I'll be kind of referencing it as we go through these questions.
Perfect, Megan. Okay, so what are the key clinical considerations when utilizing the FreeStyle Libre 14-day system in the hospital setting?
So it's very important to remember that Abbott Diabetes Care has not studied the FreeStyle Libre system in hospitalized patients. This is the same system that is currently utilized in the outpatient setting. So the sensor must be scanned in order to obtain glucose readings, the trend arrow, and the 8-hour line graph, and it does not proactively transmit alarms. So as this is the same system in the outpatient setting, the labeling for the FreeStyle Libre system has not changed. So it should be reviewed carefully for all indications and important safety information when making decisions to use the FreeStyle Libre system in the inpatient setting. So a couple things I would like to call out. It is not approved for pregnant women, persons on dialysis, or critically ill populations. And these are bulleted here as well on this page. Other important points are also really key to remember, such as poor peripheral blood perfusion may cause inaccurate sensor readings, and other clinical conditions can also affect the readings. So it's really key, again, to look at the full indications, important safety information, which you can find further down on this page. And as you can see here, you can also click out to a link for full indications for use and safety information that you would want to review.
Thanks, Megan. And then our members have been asking about what medications could cause interference with FreeStyle Libre 14-day system readings. Can you expand on that some?
Yes, absolutely. So we have known interferences, which include single doses of ascorbic acid or vitamin C exceeding 500 milligrams, which may falsely increase sensor readings, and single doses of salicylic acid or aspirin above 650 milligrams may falsely lower readings. Now there may be other reducing drugs or compounds that cause interference, but realize that most drugs used in the hospital or critical care settings have not been evaluated, so their interference with the FreeStyle Libre system is unknown. Another point to add is that acetaminophen is not an interfering substance with the FreeStyle Libre system.
Thank you. And then there's a lot of conversation about whether or not the sensor can be worn during X-ray, MRI, and CT scans. Can you speak to that as well?
Yes, obviously a very important question given the situation. And again, referring back to the labeling, I'm bringing up here that the FreeStyle Libre sensor should be removed for CT and MRI procedures, as we have not studied the performance of the system after such exposures. And the FreeStyle Libre sensor should not be exposed to X-rays, but if still being worn, it should be covered with a lead shield or removed prior to X-ray.
Thank you. And then when would the diabetes care and education specialist or the nurse need to do a fingerstick glucose while using the sensor system?
Mm-hmm. Yes, excellent question. I am going to demonstrate now how you can easily find the full user's guide, because this is a great resource with all of the accuracy information as well as guidance on using the glucose results that you get from CGM. So as you can see up here, the Education Resources tab, I'm going to click on the FreeStyle Libre Personal CGM Resources. And this is the healthcare professional site that you can see here. It's a lot of great resources, and as I scroll down, you get a view of what's available for the software, a little video as well demonstrating on how easy it is to start, and then resources for patients as well as professionals here. You can download, there's the FreeStyle Libre 14-day system users manual, and again, that is the comprehensive resource that you can find accuracy information and guidance. So now that you know what that resources is, you also must remember when making clinical decisions, take into consideration all the points that we've made above regarding safety information and limitations clearly stated in the labeling, as well as, and this is very key, your hospital policy and protocol for making treatment decisions. So remember that the FreeStyle Libre, as well as other CGM systems, glucose results are based upon interstitial glucose levels, not blood. So the users should consider all of the sensor glucose information, which includes trend arrows, 8-hour retrospective line graphs, along with the individual glucose values, and really interpret the sensor glucose results in the context of the full clinical picture. Now, the FreeStyle Libre system is a no calibration system that is indicated to replace fingersticks for treatment decisions based upon the clinical accuracy studies in the outpatient setting. And from the labeling, fingersticks are required for treatment decisions when symptoms do not match symptom readings, or when readings are suspected to be inaccurate, or when the check blood glucose symbol, which looks like a magnifying glass with a blood drop, appears on the glucose scan screen.
Perfect, thank you. And then with that in mind, does Abbott Diabetes Care have policies or procedures that can be used to implement the FreeStyle Libre system?
Now, Abbott Diabetes Care does not have policies or procedures because decisions regarding policy and procedures to implement and then how to utilize the FreeStyle Libre system really need to be made by your institution specifically. While we do have many resources and lots of information on the product available to support you, but we cannot provide guidance on those policies and procedures.
Okay, and Megan, I think this one would be kind of for both you and Bill. What educational resources do you have for the nurse or diabetes care and education specialist to get started to apply the sensor and or share resources with people with diabetes?
We do have many resources available to support both healthcare professionals and the patients, and you can easily navigate to them from the website. and there's lots of helpful videos as well. As I shared, this is a great resource to go to. And again, I am on the healthcare professionals website, and we are under the education and resources for the FreeStyle Libre Personal CGM. So you can see here there's an overview on the LibreView reports and how to get that information, libreview.com, and Bill will touch on this as well. And again, those videos that can easily help get you started with scanning, sensor application, and then all the resources, quick start guides, quick reference guides, and the full user's manual. Not only that, we do also have resources available that patients can also visit. You can see up here, visit patient site. There are so many videos and resources available that are very patient-friendly and also can be very helpful for healthcare providers as well. And I will pass the rest on to Bill because he is the expert too on getting the process and support that you may be looking for today.
Thanks, Megan. I have a full implementation team who walk you step by step through the process, virtually using from the sensor, the reader, the software app for both the Android and the iPhone, as well as the data management solutions that we have. This implementation team is familiar with. This is our role. We do this daily, and we've streamlined this process for you.
All right, thanks, Bill. And then another one for you, Bill. What is necessary to get the FreeStyle Libre system up and running in a stressed hospital environment ASAP?
Yeah, what a great question. I know that's what the folks on this WebEx are dealing with, and it's a huge concern. Start by calling our 800 number, the 800-401-1183. They can identify any IT questions you may have or questions about the product, as well as help you get the product ordered. But as I said earlier, we have a full implementation team, and I like to say my team is not an 8 to 5 team. We do early morning, we do late at night, we do weekends to help get you up and running. We understand that the best times 8 to 5 isn't always 8 to 5. We understand that sometimes you get busy in the middle of training and we have to come back to it. But rest assured, we will walk you through step by step the best solution for your organization.
Perfect. All right, this one's for Jeff. And we had a lot of questions about kind of getting started. So how can a hospital obtain the FreeStyle Libre systems? And then who is Abbott donating 25,000 sensors to, and how will they be able to get them and when?
Yes, Abbott is donating 25,000 FreeStyle Libre 14-day sensors. That's in a partnership with the American Diabetes Association, Insulin for Life, and the Diabetes Disaster Response Coalition. The sensors are available for not-for-profit hospitals only. However, FreeStyle Libre 14-day system is available for purchase directly from Abbott. And if you'd like to know more about how to obtain FreeStyle Libre 14-day system, we'll provide contact information that Bill just mentioned at the end of this presentation through an 800 number. That number will go directly to Abbott Diabetes Care initially. They'll intake your information, and then you'll be transferred to Insulin for Life to discuss your request if you're looking for donated product.
Sounds good. Thanks, Jeff. All right, and then this one's for Bill. How does the person with diabetes use the FreeStyle Libre 14-day system and share the information with the hospital healthcare team? And then how does this decrease individual people with diabetes and the contact times with the nurse?
Great question. Basically, the patient in the room would scan their sensor, and that data, there's a couple of solutions that we will offer, and I wish I had the time to go into them, but some are very robust and a lot of data, and some are very easy to implement and give you the information you need. But basically, the patient would scan their sensor, and that information through the cloud would come into a device at the nurse's station where they would be able to see that glucose result, stopping them from having to gown up and go into and do a finger stick in that patient's room.
Sounds good. So would they be able to share that through the app?
Correct. The result would, for instance, come on their phone, and then it automatically would be sent to the nursing area, whether it be through a shared app link or through our software, LibreView.
Sounds good. Okay. And then another one for you, Bill. How can the CGM data or readings be integrated into an EMR?
Yeah, usually the number one question I get, currently we don't have an EMR solution where that data automatically flows into a electronic medical record.
Okay. And then is the technology HIPAA, this is also for you, Bill, is the technology HIPAA compliant, and does it securely store health information?
Right. The LibreView, www.libreview.com, the data management app, it does store PHI, the private health information, and it is securely stored. And this is a question, and this is what your IT is going to be asking. And on the first thing I stated was to call that 800 number. We bring someone in because I guarantee this is going to be a bigger question when it comes in. But the short answer is absolutely. The data is secure, all PHI is secure, it's transmitted securely, and it's maintained securely.
Sounds good. And then this one is for Jeff. Can the person leave with the sensor, and how can they obtain more after discharge?
Sure. Yeah, since the sensor can be worn up to 14 days, if a patient's discharged in, let's say, day 4, if they choose to, they can wear the sensor up to 14 days. And then following that, for further use of FreeStyle Libre's 14-day system, all they have to do is contact their primary care physician or their endocrinologist, whoever's treating them for their diabetes. And the system is then acquired through a prescription at any retail pharmacy.
Sounds good. Thanks, Jeff. So, Megan, we have a couple of other questions that have come in for you, and you just let me know if this is more on the hospital side, because I know you did mention there a lot of these questions might be more based on hospital-specific, guidance, or if this is something that you can answer. So one is, does Abbott have a definition for the critically ill person with diabetes, or would that be on the hospital side?
No, that's really kind of more of again, sort of a clinical judgment picture of what defines critically ill. I mean, there's some very obvious medical conditions, but again, that would be, a medical definition that would take a full clinical context. But we do have specific things called out. Again, I would just refer to the full indications and safety information regarding limitations, someone that would be dehydrated, in DKA, somebody critically ill, like in an ICU, would, be a critically ill situation. But again, it would take the full clinical picture, and that would be up to the clinician to make that call.
Okay, sounds good. Is there anything else that you would want to share about this process for the clinician who, might be really wanting to get started right away before we wrap up?
Again, I would just really reinforce that the website has a lot of great information and resources. Be very comfortable and clear with, I really tried to stress the labeling and that it still stands behind our product. And there's a lot of resources for education. There are a lot of resources as far as materials and process, as Bill and Jeff have shared as well. And, we have availability to support a lot with that process, as Bill shared too. The, even live virtual trainings at this point that are possible. And then we also have compiled a list for you for further information, and we kind of broken those down into buckets. If you're sharing those resources, I know you're going to be sharing with the members, but if it's medical and scientific questions that go a little bit more specifically If after you've reviewed all of the labeling information and what you find on the website resources, you still have further questions, we do have a web page that healthcare providers can inquire for further medical and scientific questions. A lot of questions that we get, again, are related more towards product, process availability, and we also have those resources defined for you. But we're happy to help and to partner and to really provide a benefit to both healthcare providers and patients at this time amidst this crisis that we're facing.
Okay, Megan, I'm going to turn it over to you to talk a little bit about the where to find this on the website in the future, and then how people would be able to access some additional resources from us, and then go ahead and wrap up.
Sure.
Great. Thank you all. So as we stated at the beginning, we did record this webinar, so as a resource, we'll be posting it on our COVID-19 resource page, which you can access through our website, diabeteseducator.org. And for additional education, we do have a CGM certificate program that is free to ADCES members and Dana Tech subscribers. So there are 14.5 CE credits in the program. It contains various webinars and courses and case studies, and once you complete it, you will receive a certificate of completion and a digital badge. And you can access this certificate to get more information and to register by going to danatech.org.